The city of Leicester, with its 340,000 inhabitants, will not be allowed to ease lockdown restrictions on July the 4th, unlike the rest of England. The decision follows a surge in cases of coronavirus in the area, with over 800 reported in the fortnight to June the 23rd. The series of strict measures outlined in the House of Commons this evening by the Health Secretary Matt Hancock include the closure of schools for most pupils in Leicester from Thursday. From tomorrow, non-essential shops will also close, and all but essential travel to and from the city is to be avoided. Mr Hancock said that the government would keep all measures under review and would not keep them in place longer than necessary. With the latest, here's our Health Editor Hugh Pym.
Leicester city centre tonight. Pubs and restaurants which have been closed since lockdown in March, all set to reopen on Saturday along with others in England, but they've now been told they can't.
It's very disappointing. At the end of the day, we've been gearing up to reopening for this period. I mean, it was announced a couple of weeks ago, so whether it's our colleagues, our suppliers, we're all getting together, working out plans, working with health and safety about what we're going to be doing, training staff, everything, and it's just really disappointing.
As well as an extension of existing restrictions, non-essential shops will have to close from tomorrow and local schools on Thursday, and there's advice to avoid non-essential travel in and out of Leicester.
I'm not surprised because there are too many people going against what's been recommended. Personally, I find it hard because I live on my own, so it's going to be another 2 weeks.
I'm not happy about that at all, to be honest, because it's happening all around the country. Why is the Leicester only place to be shutting down and nowhere else?
It was late this evening when the Health Secretary came to the Commons to announce the measures.
Having taken clinical advice on the actions necessary and discussed them with the local team in Leicester and Leicestershire, we've made some difficult but important decisions. We've decided that from tomorrow, non-essential retail will have to close. And as children have been particularly impacted by this outbreak, schools will also need to close from Thursday.
Labour's health spokesman, himself a Leicester MP, said the outbreak had first been spotted 11 days ago and the government could have acted sooner. Earlier, the city mayor, who was expecting the announcement, didn't sound totally convinced.
I'm a little surprised that actually it's the government's deciding that it needs to be done in Leicester, because to be honest with you, the statistics, while they do show issues in Leicester, they do not show ones that are so dramatic that we should be singled out. On the other hand, if the government wishes to proceed with this, we will live with it.
Testing in the area picked up the unexpected rise in virus cases. New mobile testing units were moved into the city over the last few days to give more detail to officials, right down to local postcodes. There's been much speculation about the reasons for the increase in case numbers. Inner city areas with high-density housing, some residents vulnerable with underlying health conditions are among factors which have been mentioned. One local councillor said for some South Asian communities there were language problems with key health messages, as well as housing challenges.
When you have a large family living in a 2-3 bedroom house, that can create a huge health issues, and that I know for a fact does exist in Leicester, especially in my ward, and this is due to housing crisis. We have a serious shortage of houses.
Local authorities in the area will be given extra funding to enhance communications with residents, but businesses will be wondering what might compensate them and how long these new measures will last.
And he was with me. I'm just wondering, Hugh, what you made of this range of measures and what it tells us about concern in government and elsewhere about Leicester.
Well, Hugh, it certainly goes further than we expected, and the Health Secretary just announced it less than an hour ago in the Commons, so people are absorbing really what he had to say. First of all, we hadn't expected this closure of local schools and non-essential retail this week. We'd expected an extension of existing lockdown restrictions beyond Saturday for 2 weeks. There's no time limit being set now. It'll simply be reviewed, so it could continue. And the stats that the Health Secretary used, we hadn't heard before. Admissions to hospitals running between 6 and 10 per day. In other areas, it's 1 per day. And the infection rate in Leicester, he said, was 3 times higher than the highest city equivalent. So those stats are pretty stark. I should also say for those shielding, they'd expected a bit of a a relaxation of the rules from July the 6th. That's the most vulnerable with difficult health conditions. That now won't happen in Leicester on that day.
Are you picking up any signals from government or other bodies that they are concerned for other towns or cities and that we could see this kind of thing happening elsewhere?
Well, I think the message is this could happen elsewhere in England. The point being made is they've tried to tackle local outbreaks already on a much smaller scale. In Somerset, for example, the closure of a hospital. This is the first time they've done it with a big urban conurbation and a couple of fringe towns around the edge of Leicester. So a very significant moment in the handling of this crisis. The point being made is that if you apply these localised measures based on testing, you don't have to lock everybody down, as we've seen for the last couple of months. So that is a much more effective tool, they think, but certainly not much consolation to the people of Leicester and businesses this evening.
Indeed, Hugh, thanks very much again. Hugh Pym there, our health editor.